Hi, my name is David Crabtree, and I'm the Chief Operating Officer at the Thompson Group with offices in Indiana and in Colorado. Hi, good morning, good afternoon. I'm not sure what time of day you're going to see this video, but it is my pleasure to reach out to you this morning, and I'm excited to bring to you our benefits extraordinaire, Alan Sprunk. Alan, how are you?
I'm fine, thank you, Dakota.
Good, good. Hey, for those of you that don't know, Alan manages a group of our clients that we have employee benefits with. So this message is not only to those clients, this is to every client of the Thompson Group, whether your health insurance is with us or with another broker. We just want to provide you some information relative to health insurance carriers in the state of Indiana reacting to COVID-19. So Alan, kind of give us a brief description of what's kind of going on.
Well, we're getting a lot of calls from our clients, and they're asking a number of very good questions. And one of the questions that has come up is, well, what about my employees that are not on the plan? Can I add them? Now that this COVID-19 outbreak has hit, we've got employees that are not covered under our plan, and now they want to be. To that end, all of our major carriers, Anthem, United Healthcare, IU Health Plans, they have decided that they're going to include a special enrollment period, very similar to what you have when you have open enrollment with your group prior to renewal. Mm-hmm. They're going to add one right now. Time is running out. Anthem has said that they're going to allow you to add employees or their dependents all the way through the 15th of April under the open enrollment clause, special enrollment period. You can enroll an employee for medical, dental, and vision. Life and disability are a couple of benefits that are not going to be allowed to be added to the plan. United Healthcare has a similar open enrollment period that's going on right now. Theirs currently is ending on the 13th, but that could be extended.
Okay.
IU Health Plans, for our clients that have that, or if you're a client of IU Health Plans and not with us, they're extending their special enrollment period all the way up to the 30th of April. So,
awesome.
One of the other things that has come up, we haven't had any yet, but the question has been asked, so it's certainly something that the employers are considering. What if I lay some people off?
Right.
How long can I keep them covered? They're not interested in terminating. They want to make sure that their employees are protected during this crazy period that we're in right now. So the carriers, Anthem, United Healthcare, IU Health, they are giving you layoff provisions so that if somebody were to lay off today, cover them through the end of the month automatically. And then at your discretion, Mr. Employer, you can continue to pay their premium, and they can stay on the plan anywhere from 60 to 90 additional days.
That's fantastic.
Premium. Yep. And so that's good. And if you bring them back off of layoff, there'll be no gaps in coverage. In fact, even if you terminate them and you bring them back within 30 to 60 days, depending on the carrier, there'll be no gaps in coverage. So that's a good thing to know. One of the other things that the carriers want their clients to know is that if you reduce the hours of employees, we have a major employer in downtown Indianapolis, a highly visible employer that has asked the question, we want to keep everybody working, but we may cut back just for safety's sake to a couple of, not skeleton crews, but we're going to split them up into two groups, and we'll cut the hours back to 24 from 30. The carriers are fine with that. In this environment that we're in right now, if you want to reduce the hours on an employee, that's fine. Don't have to do anything special. They can remain on the plan, and so we have some that have cut back to 24 hours, and they're doing 2 shifts, so that works. That's fine. You can do that. They're asking about support services for employees that are terminated or they're off work sick. what's available to help them through this pretty tough time. A couple of services that are out there that we have access to through the Thompson Group is one is called Aunt Bertha, kind of a homey, almost Indiana site. And Dakota is going to try and put a link to Aunt Bertha on for everybody who sees this video and they're interested in, like, hey, I'm running out of cash and I need to get some food on my table. You can put your zip code in. It will help you find resources for food banks, places that will deliver that food. If you're looking for income, you've lost your income, there are a number of resources outside of just workman's compensation, not workman's compensation, but unemployment compensation, excuse me, that you can utilize. And so Aunt Bertha is a great resourcing tool, help you with health care and so forth. And I would encourage anybody who is looking at this video to at least familiarize yourself with it. If you can click on the link, pull it up, take a look at it. If not, share it with your employees, or if you're an employee, share it with your family. The other one is particular to Anthem clients, which we have a lot of. Anthem clients can use an app, put it right on their phone, called Sydney. Sydney, once you're hooked up with it, can get you access to a physician online. You can put your symptoms in and then speak with a nurse about that. If you need medications, you need prescriptions filled, and you don't want to leave the house, there's help there. If you want to have an online doctor visit, you don't have the virus to have a doctor visit. You may have, we had somebody the other day that has kidney stones, and they used this to find out that unfortunately you have a kidney stone. And I guess, in light of everything that's going on, maybe that's preferable. But you can get a lot of information off of the Sydney app, and we're going to try and attach them to this video. But we want you to know, whether you're our client or not, our business is to accommodate anyone who calls us. And we're going to do that to the best of our ability. So don't feel like, hey, I don't have my insurance with them, or I don't have insurance at all. We may be able to help you out. We'll try and figure out what we can do for you. We have a great staff of people here in Indianapolis, and we have access to our operating office in Louisville, Kentucky, which has another 50 people that will work on your behalf to help you get the answers you need. That's it, Doco. That's what I've got for you.
Alan, thank you so much. I appreciate it. Thank you for the update. Like Alan said, if you're a client of our benefits team with the Thompson Group or not, this is information meant to help the general public. If you have any questions at all, feel free to give us a call, 1-800-886-6655. You can visit our website, www.thompsongroup.net/COVID-19. This has all of our resources we've been sending out to our clients, all of our videos that we've been checking in with you with. Alan, thank you so much. If also in this email where you receive this video, there's going to be a link to reach out to Alan if you have any questions. He's a fantastic resource. He's a rock star in our eyes. And from us to you, stay safe, stay healthy, and we'll see you soon.